Hello, everyone. I'd like to thank you for joining us for this month's webinar. The topic is mental health and memory promotion, and our presenter is Carla Fleming, and she's a registered dietetic technician. Carla?
Thank you, Dawn. Hi, I am Carla, and I am excited to share this topic of mental health and memory promotion with you on today. What is mental health? There are some differences and similarities within the definitions given by each of these organizations. Let's start with the World Health Organization. The World Health Organization defines mental health as a complete state of physical and mental and social well-being, and not merely the absence of disease or infirmity. It is a state of well-being in which an individual realizes his or her own abilities and can cope with the normal stresses of life and can work productively and is able to make a contribution to his or her community. Mental health, as defined by Surgeon General's report, is the successful performance of mental function resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and cope with adversity. Positive mental health allows people to realize their full potential, cope with the stresses of life, work productively, and make meaningful contributions to their communities. The CDC defines mental health as a state of well-being in which the individual realizes his or her own abilities and can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his and her community. It is estimated that only about 17% of U.S. adults are considered to be in a state of optimal mental health. An estimated 26% of Americans aged 18 and older are living with a mental health disorder in any given year, and 46% would have a mental health disorder over the course of their lifetime. It is also important to note that almost 15% of women who recently gave birth reported symptoms of postpartum depression. There is an emerging evidence that positive mental health is associated with improved health outcomes. The term mental health is commonly used in reference to mental illness. However, knowledge in the field has progressed to a level that appropriately differentiates the two. Although mental health and mental illnesses are related, they represent different psychological states. Now, according to the CDC, more emphasis and resources have been devoted to screening, diagnosis, and treatment of mental illness than mental health. We have a tendency to see the same pattern with the overall general health, where in the past more emphasis had been placed on treating disease than preventing disease. Today, little has been done to protect the mental health of those free of mental illness. Research suggests that there are indicators of mental health. These include the following, which are here on the screen: emotional well-being, which is such as perceived life satisfaction, happiness, cheerfulness, and peacefulness; psychological well-being, such as self-acceptance, personal growth, including openness to new experiences, optimism, hopefulness, purpose in life, spirituality, self-direction, and positive relationships. Another indicator is social well-being. This would include social acceptance, beliefs in the potential of people and society as a whole, personal self-worth, and usefulness to society, sense of community. And lastly, we have biological. There are some biological causes of mental disorders, which includes genetic factors, which can contribute to chemical imbalances in the brain. Multiple social, psychological, and biological factors determine the level of mental health of a person at any point of time. So let's talk a little bit about memory versus mental health. So what exactly is memory? Memory is our ability to encode, store, retain, and subsequently recall information and past experiences in the human brain. It can be thought of in general terms as the power of the brain to recall past experiences or information. Memory is part of overall mental health. Now, many areas of the brain help you create and retrieve memories. A problem in any of these areas can lead to memory loss. Memory loss can be caused by many things. It can be caused by a new injury to the brain, a brain tumor, cancer treatment such as brain radiation, bone marrow transplant or chemotherapy. Also, if not enough oxygen getting to the brain when your heart or breathing is stopped for too long. Sometimes memory loss occurs with mental health problems such as after a major or traumatic or stressful event, and also by bipolar disorders. Depression can also cause memory lapses. Mental and memory health is important, but people would ask, why should it be important and why are we even having this discussion? Because an individual's mental health status can affect how they think, how they feel, and act in order to face life situations, and also how they handle stress. It also affects how they perceive themselves, their lives, and the people surrounding them, which includes their interpersonal and intrapersonal relations. It affects their choices in life. So we see the importance of maintaining good mental health is crucial to living a long and healthy life. In most cases, good mental health can enhance one's life, while poor mental health can prevent someone from living a normal life. So if you're experiencing any problems with your memory, please speak with your physician. There are many factors to consider, and some can influence our mental and memory health in a positive way or a negative way. And they include lifestyle factors, which includes nutritional factors, social factors, and biological factors. And there are other factors, but these are the three that we will dive into on today. So, under lifestyle factors, we will first discuss the importance of dietary habits on mental and memory health. Did you know that a poor diet can affect your short-term and long-term mental and memory health negatively? What are some of those dietary habits? Some studies have revealed that a diet lacking in omega-3s, folic acid, and vitamin D can lead to poor mental health status and an impaired memory, and can even result in depression. Omega-3s, which are your essential fatty acids, are mainly found in cold water fish such as mackerel, tuna, and sardines. Foods that provide vitamin D include fatty fish, beef liver, fortified cereals, fortified juice, and egg yolks. And lastly, folic acid can be found in green leafy veggies like spinach and kale. It can also be found in fruits, nuts, whole grains, and beans. It is equally important to drink plenty of water because dehydration is known to cause brain fogginess and memory lapses. To sum it up, choose to consume a diet that relies on fruits, vegetables, nuts, whole grains, fish, and unsaturated fats like olive oil, and avoid fried foods and food sources that are loaded with refined sugars and saturated fats. Exercise. Regular exercise can affect mental health in positive ways, directly and indirectly. It directly can change the brain in ways to improve memory and thinking skills. It increases your overall health and your sense of well-being and help boost endorphins in the brain, which are known as the feel-good neurotransmitters. It can indirectly improve the brain function by relieving stress and improving sleep, which brings us to our next subject, sleep. Chronic sleep problems affect 50 to 80% of patients in a typical psychiatric practice, compared with 10% to 18% of adults in the general U.S. population. Sleep is essential to the maintenance of mental health. It helps to regulate mood and allow our bodies to repair themselves and our brains to consolidate our memories and process information. Poor sleep is linked to physical problems such as a weakened immune system and mental health problems such as anxiety and depression. People who sleep poorly are much more likely to develop significant mental illness, including depression and anxiety, than those who sleep well. Sleep problems are particularly common in patients with anxiety, depression, bipolar disorder, and attention deficit hyperactivity disorder, also known as ADHD. And last but not least, we will briefly discuss stress. Stress can have the opposite effects of sleep and exercise on the brain. Research shows us that stress can lead to or exacerbate mood disorders such as depression, anxiety, bipolar disorder, cognitive thinking problems, personality changes, and problem behaviors. So it is not only important to eat healthy and to exercise and get an adequate amount of sleep, but it's equally important to keep stress at a minimum level. So what about social factors? Having great relationships with family and friends can play a vital role in mental health status and can even improve it. Marital problems or splitting up from partners can cause severe detriments on many. Not having a partner or friends, being lonely and feeling unsupported or unloved can also contribute to mental health problems. As a matter of fact, studies have revealed that mental health problems are developed with many because of these problems, and also because of work or business problems and the associated stress. For many, being unemployed and unable to work is a factor to consider when discussing mental health. Not having good interpersonal relationships or not enjoying one's job can add on stress and result in mental disorders. It is believed that discrimination, social and gender inequalities are examples of adverse structural determinants of mental well-being. Let's now discuss biological factors. You have genetics. Mental illnesses sometimes run in families, suggesting that people who have family members with a mental illness may be somewhat more likely to develop one themselves. Susceptibility is passed on in families through genes. Certain infections have been linked to brain damage. And then you have brain defects or injury. Defects in or injury to certain areas of the brain have also been linked to some mental illnesses. And then there are prenatal damages. Some evidence suggests that a disruption of early fetal brain development or trauma that occurs at the time of birth, for example, loss of oxygen to the brain, may be a factor in the development of certain conditions. So what are some common mental health and memory disorders? Research on mental illnesses is evolving day by day. As time passes, more mental illnesses are being discovered and diagnosed. Some of the more common and well-researched mental illnesses by category of illnesses include mood disorders, also known as affective disorders, anxiety disorders, psychotic disorders, concurrent disorders, and personality disorders. The few that would be briefly discussed are categorized as mood and anxiety disorders. So let's start with anxiety. Anxiety is a general term for several disorders that cause nervousness, fear, apprehension, and worrying. Anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults in the United States aged 18 years and older, and 18% of the population. Anxiety disorders, there are highly treatable, yet only about 1/3 of those suffering receive treatment. The anxiety disorder costs the U.S. more than $42 billion a year. Almost 1/3 of the country's $148 billion total mental health bill, according to the economic burden of anxiety disorder. More than $22 billion of those costs are associated with the repeated use of healthcare services. People with anxiety disorders seek relief for symptoms that mimic physical illnesses. Also, people with an anxiety disorder are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders than those who do not suffer from anxiety disorders. Anxiety disorders can develop from a complex set of risk factors, including genetics, as we discussed earlier, brain chemistry, personality, and life events. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depressive disorders encompass major depressive disorders and bipolar disorder. Bipolar disorder is included because people with this illness have depressive episodes as well as manic episodes. Approximately 18.8 million American adults, or about 9.5% of the U.S. population age 18 and older in a given year, have a depressive disorder. Nearly twice as many women, and that's 12%, as men are affected by a depressive disorder each year. These figures translate to 12.4 million women and about 6.4 million men in the U.S. The next is bipolar disorder, also known as manic depression. It's a mental disorder that causes periods of depressions and periods of elevated mood. Some bipolar disorders symptoms are similar to other illnesses, which can make it hard for a doctor to make a diagnosis. In addition, many people have bipolar disorder along with another illness such as anxiety disorder, substance abuse, or an eating disorder. People with bipolar disorder are also at a higher risk for thyroid disease, migraine headaches, heart disease, diabetes, obesity, and other physical illnesses. 2.6 U.S. adults have bipolar disorder, which can cause dramatic shifts in mood, energy, and activity levels that affect a person's ability to simply carry out day-to-day tasks. So what should you do if you are personally experiencing a mental health disorder, if you think you are? First, you want to consider the lifestyle factors that we discussed earlier and seek help. An important part of managing your mental health is learning to recognize the early signs of a mental health episode so that you can take steps to prevent symptoms from developing into larger problems. You want to consider talking to your healthcare provider if your distress leads to dangerous thoughts or behavior, such as considering suicide or physically harming your body. If your distress lasts for a long time, for like weeks, months, or years. If you feel distressed frequently and you're not sure why. If you also continue feeling bad even when good things happen. And if you find that distress interferes with your ability to live the way you want to live. Stigma of mental health. What exactly is stigma? Stigma is when someone views you in a negative way because you have a distinguishing characteristic or a personal trait that's thought to be or actually is a disadvantage, which is basically a negative stereotype. Stigmatizing beliefs about individuals with mental health problems are held by a broad range of individuals within society, regardless of whether they know someone with a mental health problem or have a family member with a mental health problem or have a good knowledge and experience of mental health problems. Stigma of mental health can lead to discrimination. Such reactions are common with people when people are brave enough to admit they have a mental health problem, and they can often lead on to various forms of exclusion or discrimination, either within social circles or within the workplace. It can also lead to reluctance to seek help or treatment, a lack of understanding by family, friends, coworkers, or others you know, fewer opportunities for work, school, or social activities, or trouble finding housing, bullying, physical violence or harassment, health insurance that doesn't adequately cover mental illness treatment, and the belief that you'll never be able to succeed at certain challenges or that you can't improve your situation. So what are some steps to cope with stigma? Get treatment. You may be reluctant to admit you need treatment. Don't let the fear of being labeled with a mental illness prevent you from seeking help. Also, don't let stigma create self-doubt and shame. Stigma doesn't just come from others. You may mistakenly believe that your condition is a sign of personal weakness or that you should be able to control it without help. Also, don't isolate yourself. If you have a mental illness, you may be reluctant to tell anyone about it. Your family, friends, clergy, or members of your community can offer you support if they know about your mental illness. Reach out to people you trust for the compassion, support, and understanding that you need. And lastly, speak out against stigma. Consider expressing your opinions at events, in letters, to the editor, or on the internet. It can help instill courage in others facing similar challenges and educate the public about mental illness. Others' judgments almost always stem from a lack of understanding rather than information based on the facts. So learning to accept your condition and recognize what you need to do to treat it, seeking support, and educating others can help you get past it and to cope with the mental health stigma that is out here in our society. How can you help? Educate yourself about mental health. Understand the power of language and how it can contribute to stigma. Stigma towards mental health issues and treatment often stems from the way we come to understand concepts through pop culture and influential others. Many commonly used phrases which can contribute to misunderstanding and a reluctance to seek treatment for fear of being perceived as weak or crazy. You can also help challenge the stigma in your corner of the world by spending some time thinking and reading about how words and experiences may feel from a different perspective. And also know how to help someone in crisis. About 1 in 5 people will experience a mental health issue in their lifetime. These are our friends, family members, and loved ones who may be experiencing symptoms of mental health issues that aren't obvious or visible. Keep resources on hand. Learn how to recognize the signs and know where you would go for help if someone you care about were to experience a crisis. Thank you for attending the webinar today. If you have any additional questions about this mental and memory health webinar, please do not hesitate to reach out to your health coach at Strategic Health Services. Have a great day.